In the world of software as a medical device, one principle has become absolutely clear. When software influences clinical outcomes, your evidence must prove clinical outcomes, not just algorithm accuracy, not just technical performance, and not just internal validation metrics. SAMD and digital therapeutics live or die by the strength of their clinical claims. Accuracy alone is never enough. You must demonstrate that algorithm performance actually leads to improved patient decisions, safer therapy choices, reduced complications, or measurable improvement in health status. Regulators, clinicians, and payers all expect evidence that ties software behavior directly to real clinical benefit. That requires prospective studies, diverse datasets, and clinical validation that reflects real care environments, not curated test sets. Data diversity is critical. SAMD must perform across varied patient populations, comorbidities, ages, sensor qualities, imaging differences, and cultural or behavioral factors that influence real-world use. Edge cases, motion artifacts, signal dropouts, incomplete data, user variability must be stress-tested because these scenarios determine whether the software behaves safely when conditions are less than ideal. Digital therapeutics taught the industry that drift isn't hypothetical, it's guaranteed. Real patients behave differently than training sets. Sensors age, environments change, populations shift. Lifecycle monitoring must track performance over time and define when interventions, retraining, or model updates are required. When things go wrong, explainability matters. Clinicians must understand when confidence is low, when outputs are unreliable, and when manual review is required. SAMD must communicate uncertainty clearly, provide safe fallback behavior, and avoid silently degrading into dangerous recommendations. Safe failure, clear UI messaging, confidence thresholds, and traceable logic are essential parts of any SAMD evidence strategy. Once software impacts diagnosis or treatment, it becomes a medical device, and that comes with regulatory responsibility. Claims must match evidence must match risk. And risk must be mitigated with verifiable controls, not assumptions. Digital therapeutics have shown that long-term performance, post-market monitoring, and human factors alignment are just as important as initial clinical validation. At Concise Engineering, we help teams define claims that are defensible, build evidence that withstands regulatory scrutiny, trace algorithm behavior to clinical benefit, and maintain performance long after launch. If you want your AI or digital therapeutic to become a proven clinical advantage, not just a promising technology, let's build the evidence that makes it real.